Hello again, everyone. Mark Hackle, Macomb County Executive, Deputy John Paul Rea. Just giving you a quick update of what's going on here in Macomb County, kind of more specific to COVID. But before we do, I gotta say, my hearts and our thoughts and prayers go out to Benny Napoleon, his family, his co-workers, the people of the city of Detroit and Wayne County. I've known him for years in the law enforcement capacity, true gentleman, and he is what I would consider to be a peace officer. And without question, over the past several years in his leadership role as a chief of police and then obviously as the sheriff, he was a leader in a law enforcement community. But just a true gentleman and somebody that every time you came across him, very engaging, and he understood how to deal with people. And so with that tremendous loss, and I know it's due to COVID, but boy, what a sad reality. We're seeing this happen amongst many people, but when you see somebody who's high profile and very recognizable go through it, it really does bring around that sense of, this is real, and people need to know that.
Mark, huge loss for our region, a community champion through and through, not only early on for the city of Detroit and obviously as Wayne County Sheriff, but also a man that knew how to captivate a room. He had a spirit about him that just brought people together, and as you said, just his ability to connect is something that will really leave an imprint on this community for many, many years to come.
Yeah, rest in peace, my friend. So with that, we know the numbers are still, higher than what they'd been throughout the summer, but still a little bit lower than what we had at the onset. Very much a concern in our hospital systems here. We're still monitoring it. Again, we know holidays are upon us, and probably going to be some of that connectivity with family and friends. You just need to be very careful and cautious. We say it enough. I think people hear about it. CDC guidelines, wearing a mask, making sure you're social distancing, washing hands. I mean, we hear it over and over again, repetitive. We just want to continue to make sure people realize, even though it's frustrating, this has gone on for quite some time, you still need to be mindful of the CDC guidelines. But a ray of hope. We're seeing a lot of good, I guess, if you will, support from the medical community and people that understand the science behind this. Now that they've kind of released the vaccine, in particular dealing with the Pfizer vaccine, we here in Macomb County did get our first shipment. And we're very fortunate because that tier we've been responsible for has been the people that are working in our health department alongside those that are what we call the paramedics, people that are licensed EMTs here in the county. So we are actually going through that process right now. We are actually administering the vaccine, and we're doing it through our Verculum building and our healthcare workers here in Macomb County from our health department. So reached out to them, got a plan together as to those that wanted to be vaccinated, how we can do that, and they've already been administering that vaccine to our workers here at the health department, as well as the paramedics or EMTs here in the county.
Mark, as you highlighted, a tremendous amount of credit goes to the health department as they've worked not only with these regional healthcare experts, the hospital systems across Southeast Michigan and the state, our state partners, and obviously the CDC, obtaining the vaccination, having those structured protocols in place. Again, we want to tell everyone, please go to macombgov.org. That's where you get the most up-to-date information about the phasing of the vaccinations, when you will be able to get certified to come in and get it, when you and your family feel most comfortable, and when is most appropriate. This is going to be a very regimented system. We're following very strict guidelines here. And again, we have a system in place that will be able to serve the public when is most appropriate.
Yeah, JP, you said two things that are very key, very important, is the people understanding, that there is a tiered structure here. And, we can't get ahead of that, meaning there is nobody who's going to go to the front of the line. They have to be part of that tier that's been designated by the federal government and or the state for whatever we get. And right now, we do have that Pfizer vaccine. It's for a specific, class of individuals, and that happens to be our paramedics. And so nobody beyond that is going to be able to say, hey, what about me? And we know that part of the tier is also congregative care, people that are in some of these nursing homes. And there is a response that we're seeing from some of the pharmacies working out agreements. We kind of mentioned it before, but Martha T-Berry is working out an agreement with Walgreens to administer that for not only their workers, but the people that are clients at Martha T-Berry. And that's what's happening with the other folks that are part of this tier, the seniors that are in some of those congregative care facilities. They're going to be getting it as part of that first tier as well. So again, nobody is going to be able to get ahead of that. And the other part that you brought up that I mentioned, I support your comment on that is, people that want to get it. Again, I can't emphasize enough, there's no requirement on behalf of the federal government, the state, and or even local that people must, get vaccinated. But there's a lot of information out there. I get asked a lot, what do you think about, promoting of this or trying to get people to do it? I always defer to the medical experts. That's what I will do. I think that's what every one of us does is talk to our own doctors, make a determination, what's in our best interest, working with your family to find out whether or not you should, if that tier period comes where you get to make that decision. And again, and not based upon what a public official is telling you or a politician, based upon what the medical profession is saying. And we're hearing good things about it. We know there are people that are still leery about it, but there's no question, if successful, this really will help us kind of get past this this COVID issue that we're seeing throughout the entire country and throughout the world. So again, rely upon your healthcare professional, your own doctors, to help you make that decision. I'd start having those conversations right now if you're not.
This is another step in the process with regards to our COVID response, Mark. We've always told the people on these video updates that we were going to be open and honest and transparent with every step that we made to make things better here within our community. This is another opportunity for individuals to collect information and get guidance and resources from credible healthcare professionals, not only in their private lives, but also from the public health professionals that have been here on the job every single day, helping this community weather this storm. It's a great week for us to kind of take another step back, get a sigh of relief. You see it on the folks that work over at the health department, whether it was Cheryl this week too, Andrew,
right.
Just kind of seeing, look, this is another positive step for us. And now it's just ensuring that you and your family have that information available via macombgov.org and can connect in with those that care for you also.
Yeah, and there's some people very emotional about this.
Yeah.
I mean, it was interesting to watch, when we did get that vaccine delivered to the health department, it was almost kind of a celebratory moment, for those that understand this from the healthcare perspective. And, just kind of watching that and taking it in, it says a lot to me that they're very confident in the vaccines and what it will do to help, I guess, if you will, eliminate COVID. So just, as you mentioned, watching those folks get excited about that delivery, because it is somewhat monumental. It's historic. And so we're very confident, listening to our healthcare professionals, that this is going to make a difference, and we're starting to see them actually administer the vaccine. We've already been doing that here in Macomb County, like we're seeing in Wayne and Oakland as well. So again, we want to continue to I guess, emphasize that need for you to start talking to your doctors and your family members to make a decision, so that when the tier comes available, and that may be sometime in the next 2, 3, 4 months, we don't know. So when we get the vaccine, or if it's allowable for some of these pharmacies to provide it, or even the healthcare system, to those of you that are still out there waiting and wondering, you need to already be prepared and kind of listen to what's going on out there. Take in the expert advice for your decision-making process here.
Mark, the idea is it'll be similar to when a lot of the testing strategies were rolled out. It used to be just one singular site early on in the COVID response in mid-March and everything, and then there were multiple test sites throughout the county where you could go and get tested and throughout the region and everything. Right now, too, similar type of strategy, whereas we're looking at the hub of activity that we'll have at the Vercuren building. I think that's another thing as you said, we'll work with the pharmacies, we'll work with the healthcare systems, we'll see what the phasing criteria is, and again, our health department is already 3, 4, 5 steps down the road, understanding what their strategic role in this vaccination role it's going to continue to be to serve the general public.
Yeah, so again, the dual thing going on right now, vaccinating those that were given the allotment to vaccinate, as well as still the testing. We're still doing the testing, and I remind people that we now have a great kind of an indoor drive-through facility for testing for COVID-19. Happens to be at Baker College, which is on Gratiot, just south of 15 Mile Road in Clinton Township. Great location. They really make it user-friendly for folks that want to get tested. Know the numbers are going down. We were testing quite a few people on a regular basis. Numbers have gone down, but it's still available. And anybody who's looking for a test site beyond just the Baker College, macombgov.org, you can get the information as to where that test location might be that you might want to go get tested at. So testing is still available, and we're still doing a great job of making that accessible.
It's been great to see the reinvigorated spirits of the folks over at the test site too, now having the new enclosed structure as opposed to being out in the tent. So
yeah,
positive step forward there.
Yeah, the weather change, I think, kind of invited the opportunity. So again, on behalf of myself and JP, we want to continue to remind everybody to keep them and their families safe. But once again, I still want to make that close, to our friend Benny Napoleon. Rest in peace, my friend.